Go. Thank you.
Start over. We're here with Louise. Louise, let's see what the range of motion is. If you can lift your arms out to the side, backs of the hands to the backs of the hands. How far up can you get that?
I can push it.
Okay, and that's pushing it, and the other hand's almost there. Okay, well, I'm going to come around. Okay, it's not awful range of motion on the appearances. And when I put just a light pressure here, I'm just going to lift your arm gently. We'll see what the real range of motion is, how that shoulder, right there it stops. If I go any further than that, it's going to cause pain, isn't it? There. Okay, so that's a true range of motion. This is Dr. Austin's test for range of motion. That's it, and the whole shoulder moves. So you're about 90, maybe a little bit over 90 degrees. Okay. What we're going to do is we're going to do some Trigenics maneuvers. I've already examined you. I know what we're going to do. So we're going to do a couple muscles and see if we can't, see what the result of that will be. Okay, so we'll be right back and see if we can get some range of motion back in there, some of that pain gone. Okay. Now we're back with Louise. Now I didn't even pre-test you or post-test you, did I? Go ahead and let's have you bring your go right on up and see how that feels. Yep, keep going. Good. Join the fingers together. Push them straight up to the ceiling and the elbows next to your ears. What do you think about that range of motion? Is that result? Now let's have you slowly lower them right back down again, slowly. Very good. Is that catch there?
Once I have catch, just a little catch.
Okay, that's pretty normal. I only did half of what, well, not even half. I did an eighth of what needs to be done in there. But we got results, we got you unlocked. How's that feel?
Okay, feels good.
Feels good? Moving around and test it? How long have you been that way, frozen up?
Well, since around, the 23rd, I can remember, of May. I've been, messing around with it. Before that, it was starting to bother me, but I just kind of put up with it. But
okay, so now you don't have to put up with it. What are you going to be able to do now that you couldn't do before that you like to do it?
Hopefully I can hook my bra and pull my pants up.
Because we're little things here. Well, good. So.
Other than that, lift things to put things away, but
right.
I don't.
So there's daily life activities.
Yeah.
So good. So you'll be able to enjoy that much better. And so you had physical therapy. Did you? Well, how many visits of physical therapy? How long did you do that?
I went to physical therapy from the 24th, I think, of May to the 26th of May of June, something like that.
Okay, so about a month of physical therapy. Did that do anything for you?
A little. Could you do all these exercises
right.
and stuff?
Okay. What other therapy did you try? We had good results with acupuncture. Okay. So. And
then I just do keep doing the exercises
that they tell you to do. But it was still frozen, so it came. Okay. Well, good. So how long did we take to do all that thing, including the instructions that I gave you?
Like 10 minutes.
10 minutes, okay. And we got your arm functioning. Okay, well, good.
So it should stay this way.
Yeah, it should stay that way. The brain is now reconnected to the muscles and the nerves within the muscles and joints. So that's now reconnected. And that is a new permanent setting. So they're talking to each other now.
Well, what do I do? What do I do to keep this going?
I will give you some exercise.
I still feel it in here.
Oh, sure, you're going to. Like I said, I only did a little bit just to see if we can get some results, and we did. Then the work starts to fix everything, and it may take 6 or 8 visits, or we'll see how quickly we can do that with you. But yeah, I'm very hopeful, and so
okay.
How does it make you feel to be able to move your arm?
Fine.
Are you happy?
Yeah. It's a little achy right now.
Sure.
Yeah.
It was achy before, wasn't it?
It sure was.
Oh,
yeah.
okay.
Okay.
Well, thanks, Louise. Thanks for letting us video this and show it.
Thank you.